I would like to introduce the moderator for today's event. Mabau, if you can please introduce yourself.
Hello, good afternoon, ladies and gentlemen, members of the profession. Good afternoon, our distinguished guests from Empower, Professor Andy, Sonia, and Sujit. Good afternoon, our senior members of the Pharmaceutical Society of Kenya. Welcome you all to today's webinar launch on the role of procurement in pharmacy practice. Ladies and gentlemen, this afternoon we're going to have a launch for this webinar. We're going to have a launch for the program and also a webinar on basically to take us through what it entails, what Empower has prepared for us in the role of procurement and supply chain management in pharmacy practice. So without further much ado, ladies and gentlemen, I want to welcome you all to today's webinar. And I want to, for us to have, before we have some ground rules, kindly go onto the chat box. Let us know where you're joining us from. I can see Dr. Jacqueline Kature from Meru. Thank you very much, Jacqueline. So the next slide, let's proceed to the next slide. So today's webinar is basically on the role of procurement and supply chain management in pharmacy practice. It is a launch of a partnership and a webinar on this specifically. We're going to have our distinguished panelists today. One of them being Dr. Daniela Munene, the CEO of PSK. Hello, Sonia, are we together?
Yeah, doing fine.
Perfect. And so we have the CEO, Dr. Daniela Munene, who's also director at the Kenya Healthcare Federation. She is going to be among one of the panelists. We also have Professor Andy. He's the director, learning and development at Empower School of Health, that is at Geneva. We also have Mr. Sachin Jagtap, who's the head of supply chain consulting at Empower School of Health. Myself, I will be your moderator. My name is Mbao Getao at communications at PSK. I'll move to the next slide. So we have to go through some few ground and housekeeping announcements. I request you to keep your mics. Muted, and you turn off your video apart from the panelists and moderators. Apart from that, I also request you to ask your questions using the chat box and raise your hand using the icon below on your. If you're joining with your phone, or if you're joining with your laptop, there are tabs below there. You're going to find the chat box or the Q&A. Kindly please put your questions on the Q&A chat box, and also there's a chat box. Can place your questions there, and also you are requested to participate in the poll so that we may know more about your interest. The webinar is being recorded. It's going live on Facebook, and it's going to be on the Empower YouTube channel. The slide that could be shared with all participants after this webinar. You're asked to kindly fill the feedback form after the webinar. So for our speakers and moderators, I will request you to keep your cameras on for better engagement. You mute your microphones when other speakers are engaged, and also please adhere to the webinar scheduled timings. Next. So the main objective of the webinar is to understand the importance and role of supply chain management. This will be finding that out of the COVID season right now, supply chain has been the most affected and most disrupted. So out of this, we're going to find better ways at which we would have been able to handle this, and how best to prepare us in the pharmacy practice on procurement and supply chain. So ladies and gentlemen, welcome. I take this opportunity to welcome you all to this webinar. I can see people from Ghana, Migori, Nigeria. Welcome all. The next slide. So this is our first poll, ladies and gentlemen, as it appears. Thank you very much, Olubusola from Nigeria. Our first poll. Kindly share the poll. So kindly go through this and try and fill in this poll. Kindly go through this and try and fill in this poll. Wonderful, wonderful. Wonderful. The first question goes there. What is your gender? The other question is about your age, the geographical region you're coming from. The other question is about, the fourth question is about what is your academic background? The fifth question is about what is your highest level of education? And the sixth question in this poll is about where you work as a person. Are you in the private sector? Are you in the UN? Are you in a donor organization? Or are you international organization? Or you can even put in others if you're not, your category does not, is not amongst this. Kindly, for those who are joining us, we're having a poll question. Please do take time and respond to a poll as it appears on your screen. Our poll time is almost coming to an end, distinguished ladies and gentlemen. Sonia, are we right now?
Yeah, I think Preksha, you can stop the polling now.
So perfect. These are now the poll results as they appear. These are the poll results as they appear. 56% in this webinar are male, 43% are female, 1% is other gender. We're having an age group between the highest being 30 to 40%, takes 50% of the attendees for this webinar. Then we have 30%, less than 30%, that is the other age group. Also, we are having above 50%, that is a 12%, above 50 years old, that is the 12% in this group. Between 40 and 50 years, they are 12%. So from what geographical region are we from? 84% say they're from Kenya. East Africa, it's 8%, that is Tanzania, Burundi, Rwanda, Uganda. West Africa, we are having 6%. Thank you very much for joining. That is, guys, that is West Africa, Nigeria, Ghana. Adeola Ayeni from Nigeria. Welcome, you're most welcome to this webinar today. Elsewhere, we're having 2%. Academic background, we are having 0 from medicine, 93% in pharmacy, 1% in nursing, the other health and other allied healthcare workers, that is 1%, 0% in management and engineering, 5% in supply chain, and others in 1%. Highest level of education, we're having a diploma at 34%, bachelor's program at 42%, master's at 22%, and PhD level at 3%. So basically, where the majority of the people work who are in this webinar today, we're having that 24% are working at the Ministry of Health, the specific Ministry of Health and government bodies. 2% are working for the UN. 4% are working in donor organizations. 9% are working in international or national NGO. 58%, that is the largest group, is working in the private sector. So we say that probably this is a very important course and program for these target group at 58%, because we are having supply chain. The supply chain gaps can only be filled best by those at the private sector. Others come at 4%. Thank you very much, Professor Aina from Nigeria, Faculty of Pharmacy, University of Lagos. We're very much honored to be with you. So we are done with our poll questions for today. That was our first poll question. So ladies and gentlemen, without further much ado, let me welcome Sonia to take us through Empower School of Health. Sonia, karibu sana.
Yeah, thank you, Mabau. Welcome you all. First of all, my name is Sonia. I'm from Empower. So let me just brief you the history about Empower, what we exactly do, and in what areas our expertise are. So Empower School of Health, our capabilities, we are in Geneva, New Delhi, Dakar, Nairobi, Kathmandu, Bangkok, New York, Harare. Empower is a capacity building organization, and we almost worked over 100 countries across multiple languages to strengthen the institutional HR capacity in global health. Empower has delivered nearly 1 million hours of capacity building content to nearly 2 lakh public health professionals globally. If you can see, our focus area is on leadership and change management, digital learning, public health procurement, and supply chain. We have majorly 5 domain areas. The first one is global health leadership, global health supply chain, COVID, HIV, TB, malaria, nutrition, MCH, AMR, etc. These are few variants over there. And the third one is new product introduction, medical lab diagnostic training, health workforce training, nurses, pharmacists, care and lab technicians, supply chain, etc. On the left hand side, you can see our partners. We have different partners or with the organization we work for and currently we are working for. This is basically our global presence, our headquarters, and you can see we have partnered with MOHAS, MSAS, CILT, Chartered Institute of Logistics and Transport, Tanzania. So these are our reach as of now, and we recently collaborated with Pharmaceutical Society of Kenya, and this is our partners, clients, and funders. You can see we partner with government bodies, UN agencies, donor agencies, academia, professional associations. These are the Empower advisors and faculty members. Professor Paul Lalwani, he is Empower director. You can see next to him is Professor Dr. Dennis Brown. He's a director of Empower Swiss. And Professor Andy is the director, training and capacity building, and he's one of the panelists for today's discussion. This is the courses which is offered by Empower. We have master course which is for 2 years and it is under development. It will be launched soon. Then we have a postgraduate diploma in English and French, which is for 1 year course and 6 months, and there are a few short courses also. So the presentation will be shared with you all, so you can have a look on it. Now we will be having poll 2. I would request you all to please participate in the polling, so we would be knowing the exact area from where you are, what are your requirements, so we can plan the other webinars in collaboration with Pharmaceutical Society Kenya, which will obviously will give you a good idea on it. Thank you.
Thank you very much. Thank you very much, Sonia, for the wonderful introduction. So, ladies and gentlemen, we go through our second poll question. So, kindly do take time to go through the second poll question. The first question is, how have you undertaken a procurement supply chain management course, PSM? The second one is, do you have any training or education related to healthcare? The third one, do you have related training and knowledge to handle public health emergencies? The fourth, what level are you working in your organization? So kindly do take time to go through the poll questions. So 1 more minute, probably you go through the poll questions, then we share the poll results. The poll results kindly. Sonia, from your end. Perfect. These are the poll results for this poll. Have you ever undertaken a procurement supply chain management course? 43% are saying yes. Those who have never taken at 30%, occasionally 27%. Do you have any training or education related to healthcare in procurement supply chain management? Some are saying that it's the 68%, that's the majority are saying some, 19% are saying none, and those who are well knowledgeable are 12%. Do you have relevant training and knowledge to handle public health emergencies? 48% says yes, 52% says no. To what level are you working in your organization? Mostly technical, that is the majority, that is 57%. Managerial at 33%. Leadership and governance at 10%. Thank you very much for participating in our poll 2 question. The purpose of these poll questions is to just try as much as possible to have an interactions and to see how best you're able to interact with these poll questions. Can we proceed next, Sonia? So ladies and gentlemen, distinguished guests from various parts of the world, guests from Empower School of Health, guests from our esteemed members of the Pharmaceutical Society of Kenya, beginning with our honorable fellows who've been able to join us today, our attendees, and various branch officials from the Pharmaceutical Society of Kenya. I want to introduce our panelists for today, and one of the panelists that I'm going to introduce now is none other than our CEO, Dr. Daniela Munene, who is the CEO for the Pharmaceutical Society of Kenya and a director at the Kenya Healthcare Federation. She is a healthcare professional with extensive experience in quality healthcare, in quality assurance, organizational regulatory compliance, and health sector advocacy. Dr. Daniela has created and managed quality management systems in the pharmaceutical distribution supply chain throughout her career. She's armed with passion for health promotion, education, and people empowerment. Dr. Daniela has also mobilized the pharmacy profession to successfully advocate for change in health policies to ensure enhanced reach of primary health care. In Kenya, we call her the ambassador for the self-test. She's going to speak more about this in her presentation. Let me not break the waters. Also, she is, in this regard, she's been part of developing various health policy documents, among them WHO guidelines on self-care interventions for sexual and reproductive health and rights, which majority of us in Kenya are regarded as ambassador. Dr. Are you there with us? Hello, Dr. Daniela. Hello, Dr.
Doctor, please unmute yourself. You're on mute. Okay, she has, she left it, maybe due to some technical reason. She will be joining soon.
Sure, let's wait.
I suggest we go to my presentation and then we come back to Daniela. Yep. We're very low on time. Yep.
Yes, Prof.
Okay, sure.
Hello, I'm back.
Okay, good.
Good, Dr. Daniela is back. Yeah.
Off. Can you hear me now?
Yes, Dr. can hear
Yes,
you.
yes, we can hear you, Dr. Daniela. Please
Sorry
carry on.
about that. Yes, so I'll take you through the role of supply chain management, which includes procurement in pharmacy practice. Next slide, please. So what do pharmacists do? What's their scope of practice? So that word cloud is literally a real quantitative exercise we did at PSK, thinking about which of our members practice in what area. And public health was big, supply chain was big, wholesale was big. So you can see if you combine supply chain and wholesale practice, a lot of us are in the supply chain. There's trade right there, those ones in trade and commerce. So we realized a good proportion of our membership actually works not necessarily on the front line with patients, but on the back end in supply chain. Next slide, please. So this is just a representation of the pharma supply chain landscape. So the squares is the stages of the supply chain from drug discovery all the way to the point where it gets to the consumer. And in the arrows, you'll see the considerations that one has to make when they're managing the supply chain to make sure that there's efficiency. So there's financing, there's data considerations. Data needs to be visible and available for decision making. There's managing people, getting the right talent. There's regulatory and compliance, and there's supply chain security to make sure that products are of good quality and in adequate amounts to fulfill the demand. Please confirm that you can hear me. I can see a participant saying there's no sound.
Hello, Doctor. I had lost you a bit, but now you're back.
No, now we can hear you.
All right.
Yeah, we lost you in between.
Okay. Well, I think the slides are pretty clear. So if you lose me, just keenly look at the slides. So we're talking about supply chain management. So what is its role in our practice? So in making these slides, I actually thought about the scope of practice that I see in our membership, and the roles that I see pharmacists carrying out within the supply chain. So I divided it into three, and one is quality assurance, the other one is regulatory affairs management, and pharmacovigilance within the pharma supply chain. So when we look at the first one, which is QA, we think about quality management systems and principles of quality management, which is customer-focused leadership, engagement of people, having a process approach, continuous improvement, evidence-based decision-making, and relationship management. Those of you on this call who are quality point persons in your organizations, I'm sure you deal with this on a day-to-day basis. Next slide, please. We're going to look at regulatory affairs management. And this is ensuring that all laws and regulations are complied with within the jurisdiction where product is being either manufactured, distributed, transported, or developed. And so regulatory affairs spans across the entire supply chain, whether we're talking about raw material department, all the way to R&D production, medical devices, quality control, quality assurance, and packaging. And so as pharmacists, we need to be familiar with the laws of the land and global best practice as we manage either drug regulatory affairs or medical devices regulatory affairs. The third aspect where we find ourselves practicing in supply chain management is pharmacovigilance and device vigilance. Next slide, please. So this is ensuring that processes are in place to capture and deal with safety and quality reports of the products that are supplied. May I have the slide on pharmacovigilance, please. So when we talk about pharmacovigilance, we're talking about reports on safety and quality of the product that we're handling, and making sure that these reports are handled in a timeliest manner. Usually the timelines are very strict to report to the authorities and to report to the necessary departments within our organizations. If we're manufacturers, reporting to quality assurance. If we're in distribution, reporting back to the manufacturer, and making sure that all the fields are captured in order for an investigation to be done on these safety reports. And so the whole process of pharmacovigilance is demonstrated on this slide, from case input to processing to case output, aggregate output, and output analysis, so that we can be able to detect signals in case there are several similar reports. So those three are really what I see as the scope of supply chain management for pharmacists in their practice in supply chain. Back to you, moderator. Thank you.
Okay, thank you very much, ladies and gentlemen, the Daktari, for that wonderful presentation. Asante for the presentation. So we move to the next slide. Sonia, are you there?
Just a sec, Mabao.
So just 1 minute. So, ladies and gentlemen, for those who've joined us late, I want to just take you through what the program that we have heard before. This is a webinar on the role of procurement and supply chain management in pharmacy practice. We've just heard one of our panelists, Dr. Daniela Munene, take us through supply chain and the scope of procurement and supply chain in Kenya in the pharmacy practice. So, Sonia, when you're ready, kindly remember to add your questions on the chat box. Kindly remember to add your questions on the chat box.
I hope you can see it now.
It's not yet up on the screen, but probably it's coming.
Yeah, it's uploading.
Okay.
Can you
Sonia,
see it?
if you are having any problem, then I will request Professor Andy can share the screen and we can continue.
Okay.
Wonderful, Professor. Thank you very much. So, ladies and gentlemen, it's my extreme pleasure to welcome our second panelist for the day. That is Professor Andy. He is the Professor of Public Health and Director of Training at the Empower School of Health. He is one of the co-authors of the Yellow Book, Managing Drug Supplies by MSH and WHO. He has over 25 years experience of working with major international funding institutions and bilateral donors. The main focus of previous experience includes effective management of pharmaceuticals, vaccines, and medical commodities, and especially the implementation of programs for the introduction of new medicines and vaccines for neglected tropical diseases. So that without further much ado, Professor Andy, you're with us?
Okay, greetings and welcome to all. I hope you can hear me well. Right, I have a lot of slides. I'm going to skip over quite a lot of them, so we keep back to something like the time scale. But you will get the full slide deck presented to you. My basic message is that right now, our supply chain is not working that well. In the global access to medicine, nearly 2 billion people, that's nearly 30% of the world, do not have access even to basic essential medicines. We're not winning. We're not getting there. It's not happening. 70 years WHO has been working on trying to improve access, and somehow we're still not there. So we have a major problem in our public health supply chain. And part of that problem, and my message to you today, is that we need to engage between supply chain and pharmacy much better than we have been doing. We need to bring pharmacists into supply chain, and we need to bring supply chain into pharmacy management. And to bring a warning there as well, the situation is serious now, but because of demographic and disease changes, it's going to be much more serious in the future. We really do have to get the supply chain working properly. So I believe that pharmacy management and procurement supply chain management are totally interlinked and interdependent. And part of our problem in public sector supply chain is we've been trying to do it without pharmacy. And we've been trying to do pharmacy management without procurement supply chain management. The two have got to work together. We have got to bring a union between the two parts to make it happen. If we look at what major players say about this, it's not just an old professor talking. Global Fund, who is responsible for massive donations, saying the vacancy in supply chain is 70%. Supply chain is using unqualified and untrained people. We're not bringing pharmacists into supply chain. And it shows we're failing in our public health programs. They're not succeeding because our supply chain is not succeeding. We've got expiries, damages, and stockouts of health commodities far too frequently. If we look at the Immunization Practices Advisory Committee, they are saying the vaccination programs are not working because the supply chain is not working. And the supply chain is not working because we haven't got pharmacists involved in the overall supply activity. If we then look towards the future a little bit, it's already the case that chronic diseases have surpassed communicable diseases. Diabetes, hypertension, all the other chronic diseases now. This brings us to a double whammy. We've now got a double burden. We've still got HIV, TB, malaria, and all the other communicable diseases to deal with. And we've now got the chronic diseases on top. We really must get the supply chain working and being able to deliver the volume of medicines that we need. The medicine situation can be improved. So far, it sounds like I've been very negative, but I'm not. I know we can turn this around. I know we can bring changes because we already have over my own career time. We've already made massive improvements, but we need to bring on board pharmacy and pharmaceutical management to make that happen. So what is this PSM I am talking about, and how is pharmaceutical management involved in it? So really, procurement and supply management is everything to get the medicines, the health products to the patient, all the way from first design, research, through manufacture and delivery, right up to the point of care. And we talk about 6 rights. I'm sure many of you are familiar with this already. But these rights, we don't mean human rights. We mean right in the sense of correct. The right medicine in the right quantity, for the right patient, at the right time, in the right condition, at the right price. And we look at the PSM cycle. We select the product. We do forecasting and procurement and inventory management, and then distribution. We try and get rational use, and we bring all the management issues to bear on that. So why is it so hard? Many of you are running pharmacy shops. You're running the supply chain all the time. Why is it so difficult? Because in the public sector, we're often working with a lead time of 24 months, of 2 years. I've got to do the 6 rights, not now, but I've got to do them in 2 years' time, in 24 months' time. If I look and compare pharmaceuticals with other products like fast-moving consumer goods. Pharmaceuticals, typically I have 9 months stock. For fast-moving consumer goods, typically they keep 2.5 months stock. So I'm keeping 2 to 4 times more stock. We look at obsolescence in pharmaceuticals, about 3% of sales are obsolescent, whereas in fast-moving consumer goods, about 0.5%, 6 times more for pharmaceuticals. But the really big area is the manufacturing lead time. It takes 120 days more to manufacture pharmaceuticals. That is 25 to 40 times more than fast-moving consumer goods. Supply chain for pharmaceuticals is entirely different than it is for salt and soap powder and all the other fast-moving consumer products. And that message is often forgotten. And that message we often have to bring forward. If I want to get the right medicine, well, that's easy. I go and look at the standard treatment guidelines and that's the right medicine. But that's the right medicine today. By the time I order and go through all the supply system, it's going to be 2 years. So what's the right medicine going to be in 2 years' time? If we look at the situation around antiretroviral therapy and antiretroviral drugs, there's been 6 major changes in treatment protocols in the last 10 years. If I order on today's treatment protocol, by the time I get the medicine to the patient, we've probably withdrawn that medicine. In antiretroviral therapy, just a few months, the mix, the percentage, the ratio of treatment protocols can change massively. And we have many examples from around the world of how fast it can change. So I'm left with a lot of useless stock. I have to try and look 2 years into the future of what medicines we're going to be using then. And especially for second-line antiretroviral therapy, even greater movements in the ratio of treatment protocols. The right time. Well, many of our clinics have got very limited storage capacity. How can I get materials there when they can't store it? How do I get deliveries during the rainy season when the roads are mudlogged and I can't get through? Normally, we would use risk management approaches, but how many pharmacists have been trained in risk management? In risk management, it's easy to make the situation worse. We can say, okay, I'll add capacity. I'll increase the buffer stock level. I'll take a year instead of 9 months buffer stock, but then I'm going to increase the rate of expiry. I'm going to increase the rate of damage all the way through. So mitigating is difficult and it requires specific training in risk management and mitigation strategies. The right price. Well, what's the right price in 2 years' time? Is it better that I should just buy 3 months stock now because the price might go down? Or will the price go up? The price on some medicines moves massively. Again, if we take antiretroviral therapy from $274 down to $64. If I'd have bought a year's supply, it would have wasted a lot of money. If I'd have bought just 3 months supply each time, that would have saved me thousands of dollars. Cost predictions are notoriously difficult, especially for second line on TB and antimalarial drugs as well. So achieving these 6 rights is not easy. It's very challenging. I have to try and look into the future, but we have the techniques. We've been doing it for a long time. We first published with World Health Organization and Management Sciences for Health, the Yellow Book, which many of you know already, Managing Access to Medicines, was published in 1982. It's been updated many times since. It's now available online and it's free. Also, the Logistics Handbook from JSI Deliver with USAID, first published 98, also available free online. So why do pharmacy and PSM have to be so interlinked? I've said they're interlinked, they've got to be interlinked. But why? Why have they got to be so closely together? Well, one of the answers is 2 of the largest areas of waste in procurement supply management are really pharmacy-related areas. And I'm going to explain that. we have this concept of therapeutic benefit. If I buy $100 of medicine, how much good does that medicine do? How much actually delivers an effect? And unfortunately, in many systems, we find it's only about 30%. So if we look at this chart, typically, the therapeutic benefit is about 30%. I waste 20% because the patients don't follow the instructions. They don't take the medicine properly, or they stop after a few days because they feel better. So I'm wasting the effect. That's really a pharmacy-related area, and that's my largest single area of waste in procurement and supply management. The next area is irrational prescribing, and we've all seen it. We get penicillin-based antibiotics and antacid mixtures at the same time, which chelate the antibiotics and make them useless. We have to try and educate and bring forward pharmacy information in this area. The other areas are more supply-related: expired drugs, improper storage damage, theft, poor quality. But it's relatively easy to move from 30% therapeutic benefit. With a little bit of pharmaceutical management, we can achieve 70% therapeutic benefit. To turn that around is not so difficult. Many areas of wastage there. It doesn't take a lot to move it around. To get beyond 70%, we really have to get organized, and we really have to have computerized and good quality systems. That's a step for the future, but getting to 70% is relatively easy and straightforward if we embrace pharmacy. It doesn't take much. Simple pharmacy ideas. Would numbered blister packs help patients to remember to take the medicine? Would pre-printed prescription pads help the clinicians follow the standard treatment guidelines? Perhaps in the TB clinic, we're going to give the same medicine to nearly every patient. We could have a pre-printed pad of prescriptions ready. Would that help? All of these ideas come from pharmacists. If we don't have pharmacists in the supply chain, we don't get this kind of technical input. So what works for us? Well, often what works is good governance in pharmacy. Many of you, I hope, will be aware of the World Health Organization framework for good governance in pharmacy. And the point about this is it includes all of the procurement supply chain management. There is a consensus that good governance is essential, and we follow the World Health Organization definitions of those good governances. And that really is bringing about participatory decision-making, accountability, transparency, responsiveness, effective and efficient and equitable and inclusive of all members of society, and following the rule of law. It all sounds pretty basic. And yet in many countries, that's not yet happening. We're not embracing the good government frameworks. We're not teaching pharmacists about good governance and the need to follow it through. The WHO guidelines are very detailed on good governance. They're available here to download. Of course, they're free from WHO, and it contributes to improving the sector. The specific awareness is on corruption and diversion of materials. It has a massive impact, and it really does help. It increases transparency and supply management systems. This good governance really does work. If we look at the situation in Thailand, from which we have well-documented procedures of when they introduced good governance in pharmaceutical management, we see massive improvements. There was a massive reduction in the cost of medicines. New regulations, new laws were revised and made far more up-to-date and modern. Information was available, and now every school of pharmacy in Thailand teaches good governance techniques. How do we bring about a change? How do we go forward and integrate pharmacy and supply chain management? Well, firstly, we have to recognize that they are interlinked. And we have to accept the major concepts of a public health approach. And that might sound obvious, and yet there's often opposition to this. The essential medicine concept. We only order medicines that are on the essential medicine list. The good governance in pharmacy, the national medicine policy, and undertaking modern pharmaceutical management. That means training staff that can undertake pharmaceutical management and procurement and supply chain management together, and incorporating all of these into academic pharmacy training. And bringing along with us the private sector, because they have this knowledge. They're undertaking many of these activities already, and we need to learn from them. Academic development right now around the world, there are 15 faculties of pharmacy, 15 countries where faculties of pharmacies are undertaking good pharmaceutical practice. The government of Vietnam became so annoyed that graduating pharmacists did not have procurement and supply chain management skills that it's now a compulsory integrated part of both the bachelor's and master's degree. For the bachelor's degree, they do 1 month of procurement and supply chain management training, and also for the master's degree, 1 month of more advanced procurement and supply chain management training. And making sure that all the materials that we are using comply with this kind of PSM training. How do you now get supply chain management training? Because many of you are pharmacists. I think 93% we saw on the poll. The introduction to procurement and supply chain management is available. It's around about a 2-month online course, but you can go at your own speed. There's no particular time limit on it. It's free. And if you pass the exams, you will get a UNDP qualifying certificate. That's the introduction. The link's available on the screen there. You can go ahead and take it anytime online. It was written by Empower. In fact, I think I wrote most of it. It's a good course, but it is only an introduction to procurement and supply chain management of pharmaceuticals and medical materials. The Empower School of Health 1-year online postgraduate diploma course. This is not free. It's around $2,500, but shortly we'll be talking about scholarship opportunities. This is an intense course. It's around 12 months. Some people take 2 years. Again, there's no particular time limit to complete on it. And it's across the full gamut. It's also available in French language. I see we had a question on that as well. So it follows all the activities. It introduces concepts such as economic order level and economic order quantities, very complex calculations, but particularly important for retail pharmacies in trying to determine what's the best deal. How do I get medicines at reliable costs? Okay. The link to it there, there's a sample and also a video explanation of that course. What about those who already have some knowledge? And I see about 50% of you said you'd already had some training. Available on the Empower School of Health website is the Competency Assessment Tool, CAT. It's free. You can go and try out your skills. It's confidential. Only you will ever know the results. It will measure your procurement and supply chain competency. You will get a radar chart like this, and then you can determine, oh, well, I'm pretty good in some areas, but I probably need a bit more training in procurement, or I need a bit more in quantification. Across the board, you can try it, see which areas you feel you might need to strengthen. If you decide you want to strengthen areas, we have individual 2-month courses for each of the areas. Again, they're not free, but you'll be hearing about the scholarship opportunities in a few moments. All of these courses are available online to follow. Most are available dual language. Okay, that is my time. It's now time for me to hand over. And I see I'm within the time limit, so good.
Thank you very much, Professor Andy, then for the great insights and experience, out of experience that you've taken us to. Asante, we appreciate and we say thank you very much from our side. In Kenya, they say Asante. So Asante Sana for taking us through that.
Okay.
Asante. So we go to the next panelist, Mr. Sachin Jagtap. He is the head of the supply chain practice at Empower School of Health. He has more than 15 years of experience with core expertise procurement. He has more than 15 years of experience with core expertise with the core expertise procurement supply chain management. His specific areas are expertise in quantification, stroke forecasting, SCM design and strategy, SCM risk assessment and management, procurement, information technology in logistics, infrastructure, warehousing, and inventory management. He has worked with Chai, Oxfam, FHI 360, and advised WHO, Global Fund, and various other organizations. Mr. Sachin, are you with us? Unmute yourself, Mr. Sachin.
Yes, thank you, Mabao. Am I audible?
Yes, you are audible. You are audible.
Okay.
Okay, so now are you able to share Mr. Sachin's presentation?
Yes, thank you, Mabao. So just to change things a bit, first of all, I would like to thank everyone, all the 400 plus participants that are here, and I also thank the previous panelists for some really good insights and talking about challenges and all the solutions. So I'll just change things a bit, and instead of a presentation, I will just share my screen to take you through a platform that we have recently developed at Empower. So is my screen visible to you all?
Yes, it is.
Okay. So friends, I think we all know that for the last 1 year or more than 1 year, we have all been grappling with the biggest health crisis that we have all seen, the biggest global health crisis, perhaps that we have all seen, definitely the biggest health crisis of this century. And still the end is far. Hopefully we'll get there. But what we have done, what we have all been doing is we have been trying to create our own response to meet this pandemic, both at a programmatic level, but also at a supply chain level. So I just want to take you all through one such initiative that we have taken at Empower in collaboration with WHO and with Goan. So just a little bit of background before I take you through this this platform, that this solution that we have developed. Last year, when this pandemic reared its head, first in China and then Asia, and then it has spread to each and every country on the globe, all the supply chains were woefully inadequately prepared, right? So I think all of us in our countries can vouch for that. We all knew, we had been warned by several organizations, individuals, scholars across the world that a global pandemic is something which is inevitable, but we somehow underestimated, procrastinated, and we failed to kind of prepare for it, especially from a supply chain perspective. And last year, we did a study with WHO Southeast Asia Regional Office, which covers 11 countries in South Asia and Southeast Asia. And we did this project along with Goan, which is the Global Outbreak and Awareness Response Network. So along with Goan and WHO, we did a project across 5 countries in the South Asia and Southeast Asia region. And not surprisingly, we found that many countries were not fully prepared to meet the pandemic at the outbreak, that is especially during the months of February to June, July, up till August last year. And one of the areas where preparedness was lacking was in terms of capacity, human capacity and knowledge. So many of the programs just did not have supply chain professionals who were trained to handle pandemic forecasting, procurement, inventory management, distribution. And a lot of people had to quickly learn, adapt, and hit the ground running. So that was what we were faced with. And then again, a lot of resources, whether it's tools, whether it's learning knowledge material, all that was also missing. So keeping, based on this study, so one of the key recommendations was to build something which can build resilient supply chains, something which will not only overcome this current pandemic, but also which can be used and which will make sure that we don't repeat the same mistakes in the future, so that we are also well prepared for future pandemics. With that in mind, we created this, what you see on your screens, a supply chain emergency response network, emergency response platform. And this platform is focused on South Asia and Southeast Asia. So that's why you see there are about 681 members in it. We've not yet sort of positioned it, or we have not yet encouraged our global members to join it. So largely we have 681 professionals, largely from these countries. We have 9 supply chain mentors who are there on the platform, who are helping these 681 members. We have 19 courses, and we also have, sorry, yeah, I can see it now. And we have about 57 different distinct knowledge resources, videos, documents, manuals, and so on. Now, these are the 4 key pillars of this platform. So people, of course, we needed members, people who are on the ground fighting this pandemic, or who are closely associated with this pandemic. They are all part of this network. These are the ones who need knowledge, who need capacity building. So these are a very crucial, and this is the focus. These are at the heart of this platform. We provide these members with support from mentors. So we have got 9 experts who have all worked for 20, 25, 30 years in this region and in supply chain response for health emergencies and pandemics. Then we have got 19 courses. These are free and paid courses. And the highlight of this is a specifically bespoke course that we have developed for managing supply chains in pandemics, in COVID and in pandemic situations, which is a free course which is available on this platform, which is part of these 19 courses. And then, like I said, we have a number of resources which these professionals can access. So it's not, so going beyond, so this platform not only provides mentor support, capacity building courses and resources, but it also provides collaborative opportunities. So we have organized number of events and webinars, chat expert group chat sessions, webinars, which allow the community that we have built and we are still building to interact with each other. Then we have discussion forums where people can post, and then people from the community and experts can respond. So we can solve problems for the community, we can collaborate. And of course, the experts and learners talk to each other. So there is a community building, collaborative element which is very strong on this on this platform. Right. Going specifically into the courses, and I would like to just quickly take you through. Yes. So this is the procurement and supply chain management course on. Yeah, so this is the procurement supply chain management course on pandemic response and preparedness. Like I said, like the platform, this is also being developed in collaboration with WHO, CRO, and COAN. So this course has 9 modules, and while many of you who are familiar with the procurement and supply chain cycle would see that all those topics are there, but each of them is oriented towards fighting the pandemic. So procurement of pandemic commodities, preparation, forecasting of commodities, including the use of essential supplies forecasting tool, the ESFT tool, which has been developed by WHO. Now, recently the version 4 of this tool was released. Then we've talked about procurement through the UN system. We've covered logistics and inventory management. Then we've talked about supply chain visibility. Whenever an emergency happens, the first, the biggest hit we take on is information. And without information, it's very difficult to plan and manage the supply chain. So that is also covered over here. We talk about, of course, human resources. Pandemic responses are, cannot be executed without humans especially driving it. And then even if it's an emergency situation, we need to ensure that quality products are available. Another follow important aspect of pandemics is that a huge amount of pharmaceutical waste is generated. And I'm not even talking about the medical waste, just the pharmaceutical waste, especially from diagnostics and from the use of pharmaceuticals. So that itself requires a lot of waste management and above and beyond what is being managed as per the current programs. And then we talk about preparedness, because preparedness, if we don't capacitate our community on this, then we will face the same situation in the next pandemic. So if we look at the different modules, largely, they are around these themes, so I won't repeat, but these are the different 9 modules: forecasting, procurement, logistics and inventory management, supply chain visibility, human resource, quality, returns and discards, waste management, and then the preparedness. So this leads to a certification. Typically, people are taking anywhere between 11 to 20 hours to do this course, but we have got good feedback both on the platform as well as on the course. So it's all this has just come up in the last 2-3 months, and we are very encouraged to see that people are helping themselves to help each other and to fight this pandemic. So it's a really encouraging and good for us. So I'll stop there, and back to you, Mabao. Thanks. Thank you very much.
Thank you very much, Sachin, for taking us through how to probably go through and even apply for the course by ourselves. So without further much ado, I want to call back again Sonia. Sonia, are you with us?
Yes, Mobile.
Yes. Just before, as Sonia gets ready, I'm well informed that the participation certificate for today's webinar is going to be, we're going to share a link. The link is going to be on the chat box. So once the link is on the chat box, kindly ensure that you're able to download your participation certificate. It shall be posted on the chat box. Thank you. Rahul?
Yes. Thank you, Mabao, and thank you, panelists, for such a wonderful presentation and webinar. Hope I'm audible to all. Am I audible?
Coming across loud and clear.
Yeah. So now the next session, which is actually the very interesting session I'm gonna share with you all, and that is everybody is looking for a scholarship and about the course and what is it that they are going to get benefited, the students. So just to just to tell you all that can you see my screen?
Yes, I can see your screen.
Yeah, so I will just take to the portion from announcement of scholarship, which is now the next part. So as you all know that Ambao School of Health is very, is glad to announce its partnership with Pharmaceutical Society of Kenya. And we have, it's our pleasure that Dr. Daniela and Mabao, you have responded to our request, and we have a MOU signed. And then, so we are just going to announce a scholarship, which will be like a full scholarship, free scholarship for one of the candidates, and 5 partial scholarships for the students who will be selected from the applications which we received and selected by Pharmaceutical Society of Kenya. And I will request Dr. Daniela or Dr. Mabao to please have some words about our partnership and what you think that how we can further strengthen our partnership with you. Over to you, Dr. Daniela.
Thank you so much, Rahul. We are very excited to partner with Empower Group for these educational programs for our members. As we know, members, our degree in school just gives us our foundation. Otherwise, when when we finish, embark on a lifelong journey of learning through continuous professional development. And so this consists of short courses, workshops, certificate programs, master's programs. That is characteristic of the life of a professional. It's lifelong learning. And so this partnership enabled our members to have a wide selection of courses that they would wish to advance their practice wherever they are practicing along the supply chain or in the front lines providing patient care. And we are very excited that we are starting this off by giving away goodies, which is a scholarship. So thank you very much, Empower team. And members, I'll urge you to keep up to date with our communications that MBAU sends out every day, so that you can be learning about new course offerings and getting reminders to look at these courses on our communication media, social media, our website, our newsletter. Otherwise, thank you very much, Empower team. Back to you, Chair.
Thank you, Dr. Daniela, for your kind words. And we are also excited to be a part of the strengthening pharmacy profession journey in Kenya, along with Pharmaceutical Society of Kenya. So just to update everyone about the process, as I said, that it is a one full scholarship, full free scholarship, and 5 partial scholarship. And this is basically on our STAR program, which is the postgraduate diploma in global health procurement and supply chain management, both in English and French, which is available. And and this is in partnership with Kent State University of US. So that's also one of the things. And I would also like to inform all the participants that recently Empower has got the ASIC accreditation, which is accreditation for schools, for international colleges and universities, which is a premier institution from United Kingdom. So they assessed our operations, our quality of courses, they met our faculty, students, and then they have awarded us the ASIC accreditation. For details, you can visit our website and you can write to us. Now, in terms of the process, the fee structure of this scholarship will be such like, our course for postgraduate diploma in procurement and supply chain its fees is USD 2,500. So when you say full scholarship, it means it's all free. So the fee is, there will be no fee charged to one student who will be selected by Pharmaceutical Society of Kenya. When we talk about 5 partial scholarship, then it means that you just need to pay $1,500. So there's a scholarship of $1,000 immediately for the 5 students or 5 participants who will be selected by Pharmaceutical Society of Kenya. And others who miss this opportunity can definitely register for the program at the initial price and send us your queries. We have got a lot of certificate courses, diploma course, and we are coming up with a master's course very soon, as there's a lot of demand and people are asking for master's course in global health procurement and supply chain. So you'll soon hear from us about that course as well. Now the process for applying will be very, very simple, that you need to send your brief CV, a 1-page note, and just describe in that 1-page note how this course will be useful to you in your career and how it will help actually improving the supply chain management in Kenya, because we want that it should strengthen the capacity of supply chain management in Kenya. So the people who want to do this course, just highlight how they can do it by a simple case study or by what you're doing in your private sector or wherever you are working. Just give some insights, and you can write it to our email address, which is there. Take a screenshot, guys. You will be getting this PPT and the presentation details also after this. So you can just send it the details on operations@Empower School of Health and at info@empowerswiss.org. So these are the email IDs So then it will be reviewed. All these applications will be reviewed by Bao School of Health and Pharmaceutical Society Kenya, and the selected applicants will be informed. They need to register and then get the fees paid for the partial ones, and for the free one they don't need to pay anything. And the link for the course is here. You can go to our website, check the details of the course on our website as well. So now guys, this is all about the scholarship I talked about. Now we move to our last poll for the session. It is mandatory for everyone to attend, because at the end I'm going to share the certificate link for which everyone has to put their details and they will get their certificate. So please, participants, yeah, here is the poll number 3 in progress. So please participate and answer the queries, answer the poll questions. So I see that people have already started polling. So the first question says, have you ever been involved in any immunization campaigns? Second is about participating in the COVID response effort in your country. Has the COVID vaccine been introduced in your country? Fourth question is, how did you find this webinar? Was it useful or you need some improvement? You are most welcome to provide your feedback. And at the end, you just click the end polling button and the poll is over. So we have already got 35% votes. We'll wait for another 1 minute. So participants, please complete the poll. So I see almost we are nearing 50% poll. So we'll just wait for another 30 seconds to a minute max, because we need to reach at least 70 to 80% polls. So please carry on and complete the poll. We reach 50%, almost like 50%. We are reaching it out. I'll give another minute. So please carry on. Reach 50% of the poll. People are still polling. Good. Please carry on. So I see there is a slowing down of the poll, but it is still happening. So last 20 seconds. We are nearing 60%. And I want at least 60% votes to happen to know the feedback, and which will help us improve our webinars for the future. So I'll just give another 30 seconds more. This is very important for people to poll. So People who have not polled, given their results, please poll and answer the questions. Okay, it seems we are nearly done. Polling has almost stopped. So please end the poll now. So here comes the results. So if you see, we have asked about, have you been involved in immunization programs? So 17% people say yes. 47% have said that occasionally they have been involved in the immunization campaigns in their country, and 36% have said they have never been involved. So in terms of whether you're participating in the COVID response effort in your country, 35% said yes, 51% said occasionally, and 13% has not yet participated. Has the COVID vaccine been introduced in your country? So it's a very good response. 99% said yes, that yes, the COVID vaccine has been introduced. How did you find the webinar? So 76% find it very useful, 24% find it useful, and 1% has given us a chance for improvement, that is, it needs improvement. So thank you everyone for sharing, for putting your polling questions. And yeah, I think we can now move ahead with the last part. And that is that I'm sharing, I'm sharing my screen, and I'll share the link for you to put in your details and get your certificate. Just a minute, please.
Okay, while we're doing that, we can probably start the question and answer session. If you have any questions, please type them in the chat box. Yes. And we'll try and get to them.
Yes, right. So I have answered most of the questions which were regarding the certificate. How do you, register for the courses? Will be getting the webinar recordings, presentations. So everything, I have written there, which were general queries, and also I've given links for people to see. And this is the link, guys, posted on the chat. I would request everyone to click on the link, put in your details, and the webinar certificate will be in your mailbox.
Okay. Thank you very much. Thank you
so
very
you
much.
Can you can even copy it, paste it somewhere. You can do it later on. However, we will be sharing the certificate links to the Pharmaceutical Society of Kenya, and and with the attendance, it can be verified and the certificate can be given to the participant as well. Over to you, Mabab.
Okay, thank you very much, Rahul. And probably Professor Andy is eagerly waiting for questions. So Professor Andy, the first question comes to you. In the private sector, PSMs tends to be under great influence from distributors and other suppliers above the retail level through promotions and discounts, bonus offers, which sometimes inevitably affect some of the quote-unquote rights. Please comment, Professor Andy.
Yes, it does. I mean, fundamentally, the private sector is profit-driven, and they will seek to do that. We can counter that by looking through these offers to see if they are really beneficial to us. And there are formula that enable us to do that. One is the economic order quantity, and the other is the economic order level. Does it make sense to go for this special offer? Does it make sense to follow this through? Now, one of the areas often misunderstood in the private sector is the difference between value and volume. The value of the goods in the private sector is often 10 times more than in the public sector. So when they are comparing 1%, 2%, they are dealing in millions of dollars while we are dealing in thousands of dollars. And it makes a big difference to the calculations and to the overall costs. So private sector will often tell you they can do supply chain for 1 or 2%. In the public sector, 5 to 7% cost for the supply chain is more common because it's lower cost goods. The actual cost of distribution is the same, but on a percentage basis, if I've got lower value goods, I get a higher percentage cost. So lots of misunderstanding, lots of driven in the private sector. Not all of it is good, but there are parts of the private sector, particularly computerization, particularly looking at costs. Often in the public sector, we don't know what the cost is. What is the cost of your warehouse? The majority of countries couldn't tell you. What is the cost of your distribution? Again, the majority of countries can't tell you. You haven't got those costs. Everybody in the private sector would have those costs at a third decimal point. So there are good and bad points in the private sector. We don't take it all. Certainly the promotion and the discounting is one of the bad points. But we can counter that with economic order quantities and economic order level calculations. Okay, next question.
Thank you very much. Thank you very much for the input, Professor. Thank you very much on that. So over to you, Dr. Daniela. Dr. Daniela, are you with us?
Yes, Mbao, I'm here.
Yes. So, Dr. there's a question that has been asked. Pharmacists are not trained on logistics, warehouse, and materials. So that's a comment by Professor Ologunzu from Nigeria. Also, the other comment that she's made that procurement and supplies management should be made to be a mandatory entity for all pharmacy students and those already working, and should receive on-job training skills for the same. So, Dr. from your end, sitting as the CEO of PSK, what is the way forward? What is the way forward? And from your end, sitting also being a supply chain expert, how do you foresee us being able to prepare the future generations? That is one, and already those in practice, how do we prepare them for supply chain expertise? Over to you, Dr.
Yeah, that's where the role of the professional societies comes in. Pharmaceutical Society of Kenya or Pharmaceutical Society of Nigeria. Our role is to ensure that we have partnerships to get continuous professional development courses available to our members. But more importantly and more sustainably is for us to have discussions with institutions of higher learning about transformation of the pharmacy curriculum to meet today's needs. And so certainly in Kenya, we've been having conversations with the schools of pharmacy about things that should be taught at undergraduate level, because it's always more expensive to train in service. It's cheaper to train people pre-service. So I think there should be a very strong collaboration between professional associations of pharmacy and academia. And this way we will transform our curricula to meet current needs and to meet universal health coverage and other health goals. Back to you, Mbao.
Asante, Dr. for your input. Professor Andy, probably for you, this is a question that you can share between yourself and Sachin, and also Dr. Daniela can comment on it, being part of the professional association leadership. The problem is that there's a comment that the problem is that most of the hospitals are not employing qualified personnel in the procurement department. Professor Andy, go first. What is your comment in that regard?
Yeah, it's absolutely true. But the other side of it is, where are the professional personnel to be employed? Who has been trained in procurement and supply chain? Where can you get these people? We're not training them. So it's a two-way street. We're employing people who are not fully trained because that's all there's available. I estimate there are at least 30,000 people in Africa in sub-Saharan Africa who need training in procurement and supply chain management. That's why we started the online courses. If we're running a university course with perhaps 50 in a class, we're never going to get to train that many people. Using the online technique, we can get and we can access and we can hope to train them. But it's still a massive undertaking to train that many people. As Daniela said, it starts really in the pre-service curriculum. It starts being part of the School of Pharmacy. And we see in Vietnam and Namibia and some other countries now, 4 or 5 countries are incorporating small aspects of introduction to PSM into the pharmacy curriculum. I understand that. That's enough. That's really all that can be achieved. Otherwise, we're going to extend the course by a year. Ours is a 1-year course for procurement supply chain management. We can't add a year onto a pharmacy undergraduate course, but we can add at least the introduction to procurement and supply chain management.
Thank you very much.
And we'll get there. Yep.
Thank you very much, Professor Andy, on that. So, Sachin, I'm coming to you, sitting in the background that you've been able to work with WHO, CHAI, and also having worked with Global Fund. What is your response to that comment?
Yeah, I think I would. I think Professor Andy covered it quite well, quite beautifully. But while we also, add procurement and supply chain management to our academic education, for those people who are already there, who are working pharmacists, and even I would say even non-pharmacists who are working in procurement and supply chain management, they could be from different backgrounds, like whether they are biomedical engineers or they are MBAs or whatever. It is, the right approach is to sort of first, get your competency assessed. Like Professor Baraklo mentioned, there is a competency assessment tool, a free tool, which is available. So it's important for individuals to first understand, who are already working, who don't have the time to go back to the university or to do a logistics course in the university, to find out where your gaps are and then choose a course for yourself, right? If you need more assistance in procurement, that's where you're lacking, and that is also part of your role, or that is part of your future career development path, then go and take courses or modules in particular courses which are focusing on procurement. If you are choosing a career, you are working in warehouses, if inventory management is your weak area and also an area which is part of your current or your expected future work, then go into that area. And then, like Professor Andy mentioned, it's very important that you need not take a break from your work and go and study. You can do it. You can find time during your evenings, your weekends, as long as you can engage yourself in online courses. And online courses now are often much more powerful than classroom courses, because you have elements, multimedia elements, interactive elements, technology elements. So this is something which you don't need to feel that you're compromising on the quality of your learning. You can still maintain that through online courses. So in summary, identify your gaps, make sure how they tie up with your growth, your interests, and then go for these specific online courses. Over to you.
Thank you very much. Thank you very much for your responses. Both Professor and Professor Andy and Sachin. So, Dr. Daniela, this is a question that comes in relation to policies. What are the gaps in policy that need to be addressed by government? That I think is in relationship to the procurement supply chain management. From the position that you see, that Dr. Daniela, what are the gaps in policy that need to be addressed?
Well, I think there's the recognition that, say, for example, materials management, finished product management, whether it's in wholesale or it's in manufacturing sector, is pharmacy practice, and therefore needs a qualified professional to do it. I think these things can be entrenched in law. They can be mentioned in policies made by ministries of health, so that institutions don't they have a policy imperative to employ a professional who is responsible for product release, for product management in the warehouse. Because sometimes it's open, then employers choose to employ anybody for those positions. I see gaps sometimes in public sector. I see in the private sector, sometimes we do better in terms of having the right positions, the right people in those positions. In a public supply chain, like the central stores of medicines of countries, it is not generally recognized that that is generally a large wholesaler, probably the largest in the country, a large wholesaler of medicines, because they're importing, they're storing, and they're distributing. And you find that they're not subject to the same rules and regulations as private pharmaceutical importers and wholesalers do, because they're government. So government doesn't police itself well. And yet these central supply stores, like for example, in Kenya, we call it KEMSA, Kenya Medical Supplies Authority, handle such a huge proportion of medicines in the country, medicines that affect such a huge proportion of the population. But because they're not quote unquote licensed, since they're government, then you will not find that they're forced to employ responsible pharmacists in the various stages of their supply chain. And so these policy and regulatory gaps need to be filled. Back to you, Chair.
Asante, Dr. Professor Andy, you have a comment on that? I've seen that I will see you nodding your head. You have a comment on that? Professor Andy, unmute your mic.
Sorry, yes, okay. We need to encourage government policy to develop with time, not to be static. It needs to keep moving. And the role of professional societies is to facilitate that development.
Okay. Well, thank you very much, our esteemed panelists for today. So, Sonia, any other question from that end?
No, Mabao, that's all.
Okay,
Mabao, thank you, Mabao, for being the moderator. And yes, that's it from our side. And I'm very much thankful to the presenters, to Dr. Daniela, Mr. Mabaos, Mr. Sachin, who have wonderfully taken us through the topic and discussed in detail the importance of supply chain management practice. And thanks to Sachin for showing the platform wherein everyone can get the details on supply chain management. And other thing is that any queries or anything related to courses or fees, I have given the information. You can connect to us on our website or send us a mail. Over to you, Mabao, Dr. Daniela, for the closing remarks.
Okay, thank you very much. Just thank you very much, Rahul. Before we close totally, I will ask Sachin for his closing remarks in regards to that to this webinar we've had. Sachin, kindly, if you give us your parting shot and closing remarks.
Yeah, thanks, Mabao. So I would just like to thank everyone for the overwhelming numbers in which you have come here to learn. And then, of course, I think through your comments and questions, we also get to learn. I think learning never stops. And when we all come together, I think we all benefit each other. I would just pray that all your families and you all stay healthy and safe. All the best to all of you. Have a great, great time ahead, and happy learning. Thank you.
Thank you very much. Professor Andy, are you still with us?
Yes, I'm still with you.
Yes, Prof. So I want to give you this chance to give us a parting shot, and probably what are you doing in Thailand that it can be copied probably in Africa and other Asian countries in matters procurement supply chain. Give us your parting shot, Prof.
Okay. Well, I'm an old man now, so I am trying to step back and let younger people take charge. So that's why I focus on some of the online training, which means I don't have to travel so much anymore. But from my side here in Thailand, where we have many tropical diseases similar to Africa, I would say, may all of you have peace, light, and tranquility. Travel home safely, and arrive with joy and happiness. Namaste.
Yes,
Namaste.
and,
Thank you very
and in the end, I will request Sonia because she has really worked hard for the preparations, and so Sonia, over to you if you need to just say something,
Thank you,
and
Rahul.
then we can move ahead for the further things. Yeah.
Yeah, thank you, Rahul. I would like to thank our panel, Dr. Danilia and Mabau, for all coordination to actually deliver this successful event and I would hope that it will be useful for all participants, and we will be organizing such webinars in future as well, and you all will be invited for the same. Thank you so much.
Thank you, Sonia. Thank you, everyone. I think we are done for the day.
Just before we close, Rahul,
Yeah.
I will probably say thank you very much for partnering with PSK. And
My
I'm
pleasure.
not allowed to probably give the closing remarks when my boss is here. So probably, Dr. Daniela, over to you.
Daniela, yes.
Your parting shot and the closing remarks.
Okay. Thank you, members, and thank you, our guests and other pharmacists from other jurisdictions for joining. For PSK members, look out for Mbao's communication about courses available, particularly this one on supply chain management, and particularly for the scholarship as well. Until the next webinar, bye-bye and have a good afternoon.
Thank you so much, Dr. Daniela. Thank you so much. Bye-bye, everyone.